And unfortunately, many of them don't even know. And that is simply because kidney disease is largely a silent disease. Well, today I'm going to talk to you about the risk factors, some signs and symptoms, and the stages of chronic kidney disease. Now, if you have been diagnosed with chronic kidney disease, I'm sure your doctor has told you about what stage you are in, either stage 3, stage 4, or even stage 5. Now, what does that mean? Well, if you have chronic kidney disease, that means that you either have kidney damage or a loss of kidney function that has been going on for either 3 or more than 3 months. So the kidneys are not working the way they should for more than 3 months. Now, where are the kidneys and what exactly are the kidneys supposed to do? So you see, this is the kidney, this another kidney. Okay, the kidneys are the two organs that are located in your lower back, okay, in your flank. Okay, and each kidney is about 9 to 11 centimeters long. So this is a real kidney, this is another one, and they are literally shaped like kidney beans. So you can see it looks like a bean. This one too looks like a bean. Now, the function of the kidney is to filter out blood and to get rid of excess poison, toxins, excess salt, excess water. Okay, by getting rid of excess salt, excess water, the kidney helps to control the blood pressure, and most importantly, the kidney helps to remove metabolic waste products and also excretion of drug metabolites. So how do you know if you have chronic kidney disease? Well, a lot of times you won't know because CKD is largely a silent disease, and what that simply means is that you have no symptoms. And in fact, for most people, they do not have any symptoms until they lose almost all of their kidney function. And there may, however, be some signs and symptoms, and I've done an extensive talk on that, and so I would want you to check out my YouTube channel. Now, since chronic kidney disease is often such a silent disease, it will also help if you knew about the risk factors for chronic kidney disease. And the number one risk factor is diabetes. Number 2 is followed by high blood pressure or hypertension. Okay, and there are other risk factors like being aged over 60 years, your race, especially for blacks. Okay, consumption of excessive alcohol, smoking. All these are risk factors for chronic kidney disease. Now, the most important way to know for sure if you have chronic kidney disease is to see your doctor. Now, when you come to us, there are certain tests we perform to let you know that you have chronic kidney disease and if you are at risk for progressing to end-stage kidney disease. So as a doctor, what test do I do to see if you actually have CKD? Well, one thing I do is to test your urine. Okay, so we take your urine sample and we test your urine. Now, in testing for your urine, we look at proteins or blood in your urine. Okay, now what are these proteins? These proteins are actually very large molecules, and the responsibility of your kidney is to make sure that these proteins do not enter your urine. And so if I see that there's either blood or there's protein in your urine, then I know that there's some damage to the kidney. So when you hear your doctor say, oh, you have some protein in your kidney, sorry, some protein in your urine, that could be a sign that you have kidney damage, even if your lab results are normal. Okay, another test that we do to screen for chronic kidney disease is the creatinine. Okay, is the creatinine test. Now, what is the creatinine? Creatinine is a waste product for muscle metabolism, and the way that the creatinine is excreted from your body, or the way the body gets rid of creatinine, is through your urine. So when your creatinine level in your blood is too high, then we know for sure that your kidneys are not functioning properly because they are not getting rid of the creatinine the way they are supposed to. So the creatinine is actually a marker in your blood to help us know if you have kidney disease. Okay, and so the lower the creatinine in your blood, the better, because that means that your kidney is filtering out or getting rid of the creatinine properly. But you remember I said that the creatinine is based on muscle metabolism. And so you can imagine that a young, thick, tall, muscular guy who weighs like 90 kg will have a greater muscle mass than a very thin 50 kg 70-year-old woman. And so then we use another screening tool to see if you have CKD, and that is the GFR, which stands for glomerular filtration rate. Now hold on, let me explain this big terminology. The GFR actually describes how efficiently your kidneys filter the blood. That is how many milliliters your kidneys filter blood within 1 minute. And so a normal GFR is actually between 90 to 100. And so the lower your GFR, the worse your kidney function. And so you see it's actually opposite of the creatinine. So you can see the higher the creatinine, the worse the kidney function. And the lower the GFR, the worse the kidney function. Now, we will talk about the stages of chronic kidney disease. So there are actually 5 stages of chronic kidney disease. There are 5 stages of chronic kidney disease. We are from stage 1, stage 2, stage 3, stage 4, and then stage 5. Okay, we will talk about the stages of chronic kidney disease. The stages of chronic kidney disease. There are actually 5 stages from stage 1 to stage 5. So for stage 1, the GFR is actually 90 or higher, 90 milliliters per minute or above. Now you see, what does it mean? It means that your kidneys are functioning properly, they are working normally, but there's evidence of mild kidney damage. So one may ask, if my kidneys are functioning properly, why am I being labeled as CKD stage 1? Okay, now you are being labeled as CKD stage 1 because even though your kidneys are functioning properly, there's evidence to show that there's some sort of kidney damage going on. So for instance, if we take your urine sample and we test your urine and we notice that there are some proteins in your urine, then it's an evidence that there's some mild kidney damage even though your kidneys are functioning properly. So that's a CKD stage 1. Then we come to CKD stage 2. Okay, the GFR is actually between 60 to 89 milliliters per minute. 60 to 89 milliliters per minute. For CKD stage 2, the kidneys are still working normally. However, there's evidence of mild kidney damage. Now, it is very, very crucial and important that stage 2 is recognized, okay, so that your doctor can explain or talk to you about some possible risk factors like hypertension and diabetes that we spoke about. Hypertension and diabetes, so that we can focus on the hypertension and diabetes, managing the hypertension and the diabetes, so that you don't progress to stage 3, stage 4, and then stage 5. Then the next stage is CKD stage 3. Okay, stage 3 is actually from 30 to 59, 30 milliliters per minute to 59 milliliters per minute. Okay, here this is actually the commonest stage where you begin to see some evidence of kidney damage. Okay, you see some manifestation. This is where usually patients complain of symptoms. Okay, so the kidneys don't work as well as they should. Okay, that is CKD stage 3. So the patient becomes actually symptomatic. Now when you come to CKD stage 4, this is where you need to see a kidney doctor and nephrologist. You need to see a kidney doctor actually on a regular basis. Okay, the discussion that should be going on is a possibility of a renal replacement therapy. Renal replacement therapy. When I say renal replacement therapy, I'm actually talking about dialysis or renal transplant, because in this stage where the GFR is between 15 to 29, you see the kidneys are close to not working at all. There's severe kidney damage, and so the conversations that should be going on together with your nephrologist or your kidney doctor should be about renal replacement therapy. Now the last stage, which is the most serious and the most severe stage, is when the GFR is less than 15, the GFR is less than 15, okay, you notice that most severe kidney damage, kidneys are very close to not working at all, or they've even stopped working. So in this stage, usually patients start dialysis 3 times a week. For advanced stages, or where the GFR is actually less than 5 or actually less than 10, we can entertain kidney replacement therapy, like kidney transplant. Okay, this stage is actually the most severe stage, and patients usually go through a lot, have so many symptoms like edema of the foot, edema of the ankle, they feel tired, easily fatigability, and this could be related to anemia.